History of treatment for leprosy. Leprosy is an ancient disease referred to in the Bible. In 1873, Dr. Armand Gerhard Hansen, a Norwegian doctor, discovered Mycobacterium leprae, the causative agent of leprosy. Following his discovery, the search for a treatment began. The first breakthrough came in 1943 when the drug Promin, developed as a treatment for TB, was found to work against leprosy with remarkable results. In the 1950s, Dapsone, an orally administered drug containing the active ingredients of Promin, became used worldwide. In 1975, the Nippon Foundation began funding WHO's global leprosy program. In 1977, Sasakawa Health Foundation held a workshop on chemotherapy of leprosy in Asia. Following discussions between experts, national leprosy program managers, WHO and NGO representatives, the workshop proposed a combination of 2 or more drugs as treatment for leprosy. In 1981, WHO recommended multidrug therapy, or MDT, a combination of dapsone, rifampicin and clofazimine. In 1991, the 44th World Health Assembly adopted a resolution to eliminate leprosy as a public health problem by the year 2000, with elimination defined as a prevalence rate of the disease of less than 1 case per 10,000 population. This focused attention of leprosy control activities, and led to a dramatic decrease in the number of cases. In particular, the Nippon Foundation's financial support for free distribution of multidrug therapy between 1995 and 1999, delivered treatment to more than 5 million patients, and greatly contributed to bring down the number of cases. Elimination as a public health problem was achieved at the global level by the end of 2000. From the appointment of the WHO Goodwill Ambassador for Leprosy Elimination to the present. In 2001, Yohei Sasakawa, then president of the Nippon Foundation, was appointed an ambassador for leprosy elimination. The goal was to help the remaining leprosy endemic countries to achieve elimination at the national level. Since then, he has made over 200 trips abroad to around 100 countries, contributing to leprosy elimination efforts. He sees the situation for himself, conveys this to the country's leaders, and seeks their cooperation against the disease.
世界中を回りました。本当によく回ったと思いますが、特に国家元首と言われるね、大統領ですとか首相ですとかという方にたくさんお目にかかりましたけども、ほとんどの方がハンセン病についての古い意識以外知識をお持ちではありませんでしたし、大統領になられてあるいは首相になられて保健省からハンセン病の問題についてレクチャーを受けたことがないという方がほとんどだったのは大変なショックでしたね。
By 2005, most countries had achieved elimination as a public health problem. This saw leprosy given less priority. There were cutbacks in budgets and personnel for leprosy services, and efforts against the disease stagnated. To help countries monitor their progress against leprosy and make further advances, WHO introduced 2 new indicators. One was the new case detection rate per million population, and the other was the rate of grade 2, or visible disability, among new cases per million population. The Goodwill Ambassador also continued to approach leaders of endemic countries and urge them to keep up measures against leprosy. In 2013, an international leprosy summit was held in Bangkok. Health ministers from 17 leprosy endemic countries with more than 1,000 new cases annually were invited. The conference secured political commitment to strengthen leprosy services, and resulted in the creation of the Bangkok Declaration Special Fund for innovative projects to improve case finding. In 2018 and 2019, national leprosy conferences were held in Myanmar and Bangladesh, respectively, attended by each country's leader. In 2021, the WHO published its NTD Roadmap 2021 to 2030, setting global goals and milestones for the eradication of NTDs in line with the UN's Sustainable Development Goals. It also published its Global Leprosy Strategy 2021 to 2030 towards zero leprosy. The strategy aims to stop the spread of infection and reduce to zero new autochthonous cases in 120 countries by 2030, via means including active case finding, contact tracing and post-exposure prophylaxis. Current status of measures against leprosy amid the COVID-19 pandemic. As the novel coronavirus began to spread worldwide from the end of 2019, measures against leprosy ran into difficulties. According to the Global Leprosy Update for 2020, there was a 37% year-on-year decrease in new cases due to disruptions to case-finding activities. There are concerns that hidden cases will lead to increased transmission and result in more cases with disabilities. On the other hand, stakeholders are working hard to maintain services, even in the midst of the global pandemic. Meanwhile, WHO is making more services available online, including digital health initiatives for diagnoses, referral, monitoring, and training. In Nepal, self-help groups of persons affected by leprosy and Lalgarh Leprosy Hospital cooperate on supporting self-care for persons affected by leprosy, including the distribution of self-care kits to prevent disability. In Brazil, the social movement Morhan carries out awareness raising through publications, websites and social media, and offers a consultation service via smartphone, Saphansen. Between April and August this year, it received over 1,000 inquiries. Measures against leprosy going forward.
各国のね、保健省というのはさまざまな病気を管轄をしております。ハンセン病というのは、人口比でいくと割と低い数字でございますので、どうしても予算も回らない、また担当のお医者さんというのも非常に限られていると。そして、患者さんは長いその差別の歴史の中から、この病気は痛みもありませんから気がついてもなかなか病院に行きにくいという事情がございますから、やはりこの問題はその国のトップの大統領や首相にお会いして彼らからこの病気をなくそうという声がかかることが全てを動き出す基本的なことだと私は思ってますので、コロナが終わりましたらまた各国を回って大統領や首相にこの問題の重要性ということを認識していただき、また活発な活動に戻るように努力をしたいと考えています。ハンセン病だけは他の病気と違う特色があります。それは差別という人権上の問題でして、治った人たちもまだ社会から差別という厳しい病気、社会が持っている病気があるわけですから、これを治していくということは人類の歴史にとってですね、私はもしこれが実現すれば画期的なことだと思っております。これからは関係者もあるいは回復者の皆さんも積極的にやっぱり SNS を活用してですね、世界にはこういう問題があるんだよということを一人一人が広報できる時代になりましたから、他人事ではなくって自分事として関係者がそれぞれ情報を発信していくということが大変重要な時代になりましたし、